Okay, so now we jump over time and we go to 2016, which the UN General Assembly special session on the drug problem was organized. It was a very important event because this was a movement that led to the agreement to the outcome of that General Assembly, and it involved many countries, many civil societies, many expert groups that agreed overall that what was needed was a balanced approach. Well, a balanced approach can mean many things to many people, but that it needed to be people-centered and health-centered, right? So I'll get back to that later. But that was the agreement, and of course the Philippines has endorsed this. Next slide. Okay, so in short, there were like 5 main chapters to that document. One was on demand and supply reduction, and we will of course get back to this. One was on the access to controlled medicines, while preventing diversion, and a number of cross-cutting issues, human rights, youth, children, women, and communities, new challenges that are emerging, and for instance, the new psychoactive substances. This is not so much an issue in the Philippines right now, but some of them are of concern in the Philippines too. Strengthening the international cooperation. This business, the 60 billion business I was mentioning earlier, is by nature transnational. So without a minimum of collaboration between the countries, it would be impossible to have any efficiency. And alternative development. This relates to, for instance, sustainable development through crop substitution in certain areas of Myanmar, for instance. Next slide. Okay, so to develop that health approach, there are some essential components. First, to start with addressing the stigma and discrimination. I remember when I was saying earlier that words do matter. If we do not have a different perception of what a person who uses drugs, or a person who could use drugs, or a person that recovered from using drugs, if we do not have a more accurate perception of that person, there is no way we're going to be able to address the needs of that person medically, psychosocially, etc. The second part is it is important to recognize drug use as it is, which is a chronic condition occurring most of the time together with some mental health conditions that should be seen as a medical condition and not as a criminal condition. I'm not saying that the criminal aspect is not important, of course it is, but we should make the difference between what is of public health nature, whether versus what is of public security nature. That includes prevention, but again, prevention, evidence-based prevention. A lot of the prevention that has been implemented in many countries is more goodwill or political stance rather than something that has been evaluated properly. And there is evidence-based prevention, and we're happy to support different partners, for instance, on this. Next slide, please. And of course, that's what we are gathered today for, collect and use scientific data to feed the policy-making decision, research, and cross-cutting participation. I think that cannot be something more cross-cutting than what we have today, you know. So those are some of the elements that are part of those operational recommendations that came out of UNGAS. And I must say that there are not so many forums I've seen. I've been working in this region for the last 20 years in Southeast Asia. I've not seen a forum like this in other countries, and I've not seen a mobilization of different stakeholders so impressive than what I've seen the last 3 years that I've been in Manila, and the last 7 or so years I've been working on the Philippines from the office in Bangkok. Next one. Okay, so chronic multifactorial dimension that is best addressed when there is a voluntary participation of individuals. I was saying that again, cooperation, international cooperation, and of course, support the different sectors, of course, the health sector, but social welfare, law enforcement, criminal judges, prosecutors, etc., etc. Local government, of course, to get sure that the right approaches get implemented, evaluated, and scaled up. Next. Okay, so just maybe to insist on that, and I know that what has already been shared by different speakers in the pre-conferences and what will be shared would just contribute to that. But I think it's important to try to fight that idea, right? If you would ask someone in the street many times, because of the stigma and discrimination I was referring to earlier, people would say, what is a drug user? People would say he's a junkie, he's 19, his life is over, he's going to lose his teeth and die of overdose in the corner of a street. And that's a little bit the stereotype that accompanies people who use drugs. In fact, first, there is a variety of ways to use drugs. And in fact, if we take 100% using shabu, methamphetamine, about 9 out of 10 do not have a drug problem, like from a medical point of view. And so those 9 out of 10, they can be serviced in the community at a relatively reduced cost. And we have seen good example of that in the Philippines. I'll get back to that later. Next slide. Yes, this is a detail of what would be required in the health response, but we'll get back to that later. So next slide. So this one is important, and it resonates with what Gustavo, our resident coordinator, mentioned. We have that initiative on joint initiative on human rights, and it's very important that there is non-discriminatory access to health, that there is a gender perspective. Women are more vulnerable to drugs in all sense. On the health part, they are more likely to become dependent, for instance, and when they are being thrown into the criminal justice cycle, the prison, pretrial detention, they many times take the blame for crimes that are committed by males, in fact, and they are there victim of rape, harassment, and so many other vulnerabilities that are more specific to women. Of course, this is not about just doing what we believe. We need to have a monitoring of the quality of the drug treatment and services, and we need to have a good collaboration between justice, education, law enforcement, social, and health. That is the challenge. That is a challenge in most countries, and it is in the Philippines. Next. So, in the interest of time, I won't go through all the measures, but some measures are related to the criminal justice system, and it's very important that we do send a person to prison when it is really needed. Meaning, there is a big majority, in fact, in the Philippines, of people who are in pretrial detention. They are innocent until proven guilty, and sometimes they have non-violent crimes. So is sending them to a prison or a jail a good idea from a criminal point of view, because they are going to be in touch with much tougher criminals, and even from a health point of view, the prisons are incubators for communicable diseases, right? And most particularly in our COVID time. Yes, there are a number of progress that have to do with the criminal justice system that would change significantly the way that people are being protected from drugs in a way. Next slide. So yeah, just to remind that the Philippines is signatory to all the drug convention, and the NGAS, and other committing documents. Just to add, there is a more recent 2019 ministerial declaration, which is to strengthen the actions at the national, regional, and international level to accelerate the implementation of our joint commitment to address and counter the war drug problem. And if you want, you can check the World Drug Report. There are booklets specifically addressing those issues. As I was mentioning, the access to controlled substances for medical use, international cooperation, nexus between drugs and violence, and drug and the criminal justice system. So today, we will use this forum to discuss the Philippine drug policy in a way to see research expert papers and identify further research gaps for the years to come. Next slide, please. So I didn't want to do that, but just very quickly. We have the main issue for the Philippines is shabu, is methamphetamine in its highest form, and we are in the region where we have the epicenter of production, consumption, and use. More than 50% of all the global aspects, I mean, the trafficking, the use, etc., is in Southeast Asia. The second one would be in Las Americas, in Mexico, and around. But we are in the epicenter. Next slide. We can see that the price of drugs is not increasing despite the efforts in the different countries of the region. And next slide. And the quality of the purity of methamphetamine is stable or increasing. If we cross that with other data about seizures, the point is the traffic is continuing and increasing in the region at the same pace as in the rest of the world, and that the prevalence in the Philippines, for instance, is comparable to the prevalence in Indonesia, Thailand, in the region, and in many other countries, around 2%. So that's a major problem, but it is similar to many other countries. Next. Next. We can see that the trafficking was not stopped by COVID at all. Traffickers have regrouped, reorganized, identified new routes, and the seizures continue to be record seizures now. And a big portion of the shabu available in the Philippines, for instance, comes from the northern Shan State region in Myanmar. That's where it is produced in an industrial manner for the whole region. Next slide. So in front of that, I think it was also good to remind ourselves about a number of good developments in terms of drug control, drug policy. The client flow that has been developed by so many partners, but led by the Department of Health, and then also the Dangerous Drug Board, is a very unique tool. It's not a technical tool. It's a tool to try to find a solution for the 1.3 million surrenderers, not just leave them on list, but give them the services they need, assess their level of drug dependence, and then direct them to services. We have an expansion of the services of community-based drug treatment and rehabilitation. We also have a strategy that is in this strategy, the pillar on drug demand reduction is really aligned with the recommendations. We have good piloting of evidence-based prevention, and for instance, the recovery clinics and outpatient clinics that have been established since a couple of years. Next. Okay, so I won't go into detail, but all is there, and I'm sure that the DDB or others will mention more details about the Philippine anti-drug strategy that was signed by the executive order of President Duterte. Next slide. A number of initiatives and documents and policy guidance has been issued by the Department of Health, the DDB, the DILG. That is what Dr. Armando Cristomo was referring to when he was working on harmonizing the curriculum, and then by that exercise realized that there were so many people doing the same thing and trying to contribute to that, which I guess in a way contributed to the birth of the Asian Consortium on Drug Policy. Next slide. So this is the client flow. So it's there is of course a version for the DOH, but and also there is a resolution regulation from DDB. Next. So this is the algorithm of the client flow, but I guess many of you are already familiar with it. Next. And next. Okay, so this is from the World Drug Report, and I guess it's interesting, no? It's to see that what in crime, what is a part of drugs, right? This is an assumption, yet people using drugs are criminals, and they are not systematically becoming criminals, far from that. And even if we see the stats, the drugs that seems to have the more influence on criminal behavior is alcohol, by far, right? This goes a little bit against some ideas. Next slide. And these show the response, right? So you can see the number of people arrested, convicted for trafficking, for use, people sentenced in prison. So this is creating a big burden for the criminal justice system, notably for the prison systems, prison and jail system in the Philippines for BJMP and BICO. Next slide. So those are activities that are supported in the prison in Cebu, for instance. Next slide. And other activities that contribute to the same purpose described under the operational recommendation of the United General Assembly Special Session on the World Drug Problem 2016. Next. And what is important, of course, is to get sure that the law enforcement, the drug law enforcement, is aware of that health response and knows how to cooperate while doing its job. But the collaboration of law enforcement is absolutely fundamental, and we've been engaging a lot with the law enforcement sector to try to bridge the gap sometimes that we have between the law enforcement and health and psychosocial response. One of my chronic expression is public health is public security. Without public health, you don't get to good public security. If we don't provide the right services, the business will continue to thrive. Next. I won't ridicule myself trying to talk Tagalog, but I think this slide is relatively self-explaining. And next. And next again. So this is the theory of change, right? We don't do research just for the sake of doing research. We do research to identify the triggers of what could change the dynamics, and that theory of change applied to drugs is I think interesting. Next slide. Okay, so the conclusion should be what did we already identify and what are we going to work on in terms of research gap and operational research, right? Research to support intervention. There are many, and I'm aware of what the other speakers are going to say, so I don't need to go into details on that, but just maybe to highlight one. It's all what relate to women in conflict with the law, incarcerated, serving very long sentences, victims of abuse and mental health issues. And for instance, in the current context, pregnant women extremely exposed to COVID. So I just pointed one because I guess that would be the pleasure of what we are going to discuss in the coming in this day. What is going to be identified is going to be reviewed by the Academy in at least 10 webinars and roundtable discussion. And those discussions will be reported later. So I really encourage you to listen to people that are much more interesting than me, the speakers that are going to follow through. I guess that's all for me for now.
Thank you, Mr. Olivier Lemaire. I think that was a very comprehensive discussion and a very good keynote lecture. It does show that you're such an experienced manager, and your extensive work in Latin America, the Balkans, Southeast Asia, and South Asia, as well as work with a lot of nonprofit organizations, political science groups, capacity development, government, have all been highlighted in this keynote lecture. So we'd like now to present the certificate to you. The Department of Science and Technology, the National Academy of Science and Technology of Philippines, and the Asian Center for Drug Policy would like to present this certificate of appreciation to Mr. Olivier Lemaire in recognition of his invaluable contributions as keynote speaker at the National Substance Use Science Policy and Information Forum with the theme Substance Abuse in the Philippines, Governance, Research, and Practice, held on the 15th of June, 2021 in Manila, Philippines. This is signed by academician Carmencita Di Padilla of NASD Philippines and Dr. Armando Crisostomo of the ACDP. We'd like to give you a virtual applause. Thank you very much again, Mr. Olivier Lemaire. We now move on to gauge the diversity of our webinar participants. And let me now call Dr. Leslie Michelle Dalmasio. Dr. Dalmasio is currently a professor of the Department of Biochemistry and Molecular Biology, the College of Medicine, University of the Philippines, Manila. She holds a PhD in Molecular Biology and Biotechnology from the University of the Philippines, Los Baños. And in 2012, Dr. Dalmasio became the recipient of the NASD Outstanding Young Scientist Award in the field of molecular biology and biotechnology. Dr. Dalmasio will facilitate now the forum's Mentimeter poll. Leslie?
Good morning, everyone. It is my pleasure to join and assist in this forum through this Mentimeter activity. So Mentimeter is an online tool that captures the immediate and first response or the top-of-mind answers of the plenary on quick questions that we have designed to assess the diversity of attendees. Likewise, this will be a useful guide for our speakers in calibrating their presentations. In this activity, we would like to advise everyone to access the online poll. Kindly go to menti.com, using your device or smartphones and enter the code 41067958. Again, that is menti.com and the code is 41067958, which is also shown on the upper side of the slide on your screen. May I ask the Secretariat to place the code and the instructions in the chat box? Thank you. So for every question, 1 minute will be provided for the attendees to answer. Our first question is, what city are you in right now? Please key in your answers. So let's see. So I see that most of you are from Quezon City, and there are also attendees from the Visayas and Mindanao. I see attendees from the northern part of the Philippines, from Baguio City, from Iloilo City in the Visayas, from Davao in Mindanao, and other cities in the National Capital Region. But based on our poll, most of you are from Quezon City and Manila. Now we can go to our second question. Our second question is, how old are you? Please key in your answers so that we can see the age range of our participants in today's forum. So now we are seeing that many of you are in your 30s. There are also very young participants, 21 or 22 years old. But there are also senior participants in our forum. But we see that most of you are in your 30s. Perhaps we can now go to our third question. What is your current occupation? The timer starts now. So from the allied medical field, and we also see teachers and government employees. For the professions of our participants, so many are government employees and teachers and nurses. This is quite a diverse group. The occupations we see here are more diverse than the city where our participants come from. But we see a lot of government employees and those, and also pharmacists and social workers and psychometricians. Oh, we also see dentists and guidance counselors. So this is a diverse group, but I think the stakeholders are all here in this forum. And for the last question, for our fourth question, we would like to ask, what is your expectation? Or give 3 expectations from this forum. So we can have the timer start now. None. So you will just be listening to our speakers and perhaps learn from this forum. But we also see, okay, that you are expecting that this forum will be informative, that you will have new learnings, and that it will be interesting. Of course, you would like to learn more about the topic and the issue, learn more about drugs, and for awareness. Oh, so you have a lot of expectations. Enlightenment. I also see enlightenment. So that's good. Perhaps a new perspective on the issue. Also to learn about research and policy. So we have a lot of expectations from our participants, but what is consistent in the answers is that it is expected that this forum will be informative and will provide awareness and updates on the topic. So everyone, thank you for participating in our Mentimeter poll. That concludes our short warm-up for this morning. I believe our speakers have taken note of your responses.
Thank you, Dr. Dalmasio. Before we proceed to the discussion of the 5 topic areas of this forum, let me now introduce our session facilitators who will in turn introduce the invited speakers and the 5 topic areas in this forum. Our sessions will be facilitated by Ms. Jo-Ann de Belen, the Senior National Program Officer of the United Nations Office on Drugs and Crime of the Philippines. Ms. de Belen is an experienced international development worker with specialization in the development, management, and evaluation of programs ranging from emergency response to long-term community development. With over 20 years of professional experience in Southeast Asia, especially the Philippines and Indonesia, implementing post-disaster recovery, community-based disaster risk reduction, as well as long-term community development. In addition to Ms. de Belen, we also have Dr. Elmer Soriano. Dr. Soriano is the Managing Director of Civica Asian Development Academy and currently one of the co-conveners of the Asian Center for Drug Policy. Dr. Soriano is also a part-time governance innovation mentor for Galing Pook Academy and also a national selection committee member for the same organization. His other affiliations include adaptive learning trainer for ASEA, consultant for Sea Oil Philippines, WHO, and the Asian Development Bank. So before we begin, we'd like again to invite everyone to join the online conversation using our official hashtags at Substance Abuse Policy PH, hashtag Pilipinas, and hashtag ACD Pilipinas. To our virtual audience, please key in your questions in the Q&A box of this Zoom webinar. If you are watching through Facebook Live, please type your questions in the comments section. The speakers and the panelists will answer them during the open forum. Also, let me remind our resource persons that they will be given 15 minutes each for their presentation. And to facilitate the first session on the substance use in the Philippines, identifying the key issues, may I now call on Ms. Jo-Ann de Belen of the UNODC. Ms. de Belen, the virtual floor is now yours. I think you're on mute, Jo-Ann.
Sorry about that. Thank you, Academician Chung. Good morning, everyone. The drug use situation in the Philippines consists of a myriad of overlapping circumstances, lenses, and frameworks. In this first session, topic 1, our speaker will be focusing on exactly how deep these issues run, what is being done to address them, and which specific sectors the drug problem impacts, as well as the research gaps and policy recommendations. Let me now introduce you to our speaker. Our speaker for this topic is Undersecretary Benjamin Reyes, one of the permanent members of the Dangerous Drugs Board, or the DDB, Undersecretary Reyes is also the chair of its Drug Demand Reduction Committee. He is a career professional with the rank of Undersecretary and a combined 22 years in public service, a career spanning 10 years in DDB's leadership and over 12 years in the Department of Health's units. Yusek Reyes has represented the Philippines in many UN and ASEAN conferences and workshops on illicit drugs and drug demand reduction. He's a doctor of dental medicine and holds a master's in public health majoring in biostatistics and epidemiology, both from the University of the Philippines. He also holds a master's in development management from the Asian Institute of Management. Undersecretary Reyes, the screen is now yours.
Everyone, I was tasked to present the output of Cluster 1, gathered during the online forum conducted last April and participated by various stakeholders. The following key issues have been identified to strengthen the campaign on substance use in the country. First, we need to examine the environment, the context in which we implement drug abuse interventions. At the regional level, ASEAN accounts for around 8.5% of the global population. From 633 million people in 2015, it is expected to grow by 741 million people in 2035. By 2025, Indonesia, Philippines, and Vietnam will be three of the ASEAN countries with over 100 million of their respective national population. Despite the growing uncertainty in the global economy, the bloc's economic performance remained promising. ASEAN has the fifth largest economy in the world, with a GDP of around $3 trillion last year, a significant increase from seventh place it had 5 years ago. Notwithstanding the Philippines Human Development Index value increasing by 21.1% between 1990 and 2019, the country is ranked somewhere in the middle at around 107th out of 189 countries in poverty and healthcare access. Of course, suffice it to say, governance issues still persist. And of course, these factors drives the expansion of the global drug market and syndicate operations in the region. Utilization of technologies and various communication platforms contribute to the evolution of operations and migration of organized crime, and therefore conventional drug law enforcement measures in an expanded and complex drug market with a network of cross-regional drug syndicates becomes more challenging. Despite the drug problem being generally acknowledged as a biopsychosocial concern, many still relate to the drug campaign as an enforcement issue. This mindset guided the underlying policy framework laid down by the Comprehensive Dangerous Drugs Act of 2002, a 19-year-old law which is currently in review in Congress. There is a growing realization that approaches to drug prevention and control must be reviewed and updated. Some of the biggest seizures of PIDEA happened during the pandemic. In fact, just last Sunday, June 13, authorities seized around 155 kilos of suspected shabu with an estimated value of around $22.4 million in two separate drug busts last Sunday. COVID did not impede the operations of these drug syndicates. And of course, we need to review how issues related to the consequences of drug response solely based on conventional criminal justice and law enforcement system is holding up. In the region, methamphetamine remains to be the main drug produced and abused, driven by the shift in the Mekong Delta region from cultivating opiates to synthetic substances production. We also see new technologies being used to produce new substances entering the market at a cheaper price. Now, In the Philippines, 80% of the more than 42,000 barangays were classified as drug affected. 2 of every 100 Filipinos are current users. And drugs are trafficked from abroad or locally produced. The campaign, as mentioned earlier, is guided by the current law and, of course, the Philippine Anti-Illegal Drug Strategy, which aims to achieve drug-free sustainable communities by 2022. The campaign is implemented by government agencies through the Dangerous Drugs Board and 15 other social development and security agencies. DDB issued resolutions and regulations which can be downloaded at the DDB website, www.ddb.gov.ph, ensuring that that there is adequate supply of drugs for medical and scientific purposes, and further ensuring that diversion of drugs from licit sources to illicit channels are prevented and that Filipinos are able to access the vital services. Enforcement-centric approaches resulted to the following situations presented in this slide. And there is a need to study possible transitioning to a more balanced approach to substance use campaigns, taking into consideration cultural, economic, and social dimensions of substance use as mandated by PADS. We also need to examine closely the following: jail and prison overcrowding, stigma and discrimination against people involved with drugs, violations on the right to life and right to health, and contributions to health issues. Of course, there is a need to emphasize and strengthen the foundation of drug-related responses. We want to assert respect and promotion to human rights, human dignity as core foundations of drug-related responses, which is actually mentioned and highlighted in PADS. We also want to strengthen the engagement of PWOODs in the design up to the implementation of these responses. We want to sustain multi-sectoral collaboration, improve programs and services in the different phases of the continuum of care, from prevention, treatment, and reintegration. On gender and substance use, right now we only have 3 facilities catering to women, and it goes without saying that gender issues must be incorporated in intervention programs. The community-based rehab program is an emerging field in the ASEAN region. And we're proud to mention that Philippines is the first to institutionalize the program through a policy. 723 out of 1,482 cities and municipalities implement CBRPs. But admittedly, reintegration of PWOODs into their respective communities is the weakest component of the program. Systemic healthcare issues under a devolved setting must also be examined. Integrated services must address continuum of care under existing health insurance systems, our PhilHealth. Health services and treatment is almost always insufficient for persons deprived of liberty. The new normal also necessitates more online services in relation to substance use, including counseling, assessment, among others. We must address efforts to study the effectiveness of online platforms in the delivery of treatment and care services. Of course, we must emphasize the need to involve everyone in strengthening drug education to combat substance use stigma and discrimination. Expand the discussion on drugs and substance use in the education sector. Of course, we need the academic community to participate in shifting messages about substance use towards a more holistic understanding geared on public health. So these are just some of what we need to do moving forward. First is the full implementation of DDB issuances on the provision of interventions. We also want to institutionalize public health approaches on substance abuse. We want to integrate holistic, interdisciplinary, integrative, people-centered, multi-cross-sectoral, and public health approaches in substance abuse intervention frameworks. As previously mentioned, the establishment of a PhilHealth package for the entire continuum of care for community-based rehab programs to outpatient programs and to inpatient programs must be done, as well as the expansion of online health services for concerns related to substance use. We must strengthen whole of government approach to substance use, emphasizing response to the underlying determinants affecting substance use. We must provide programs assuring adequate livelihood, gainful employment, skills, training opportunities, access to economic activities to disincentivize participation in problematic drug trade. The need to strengthen the establishment of community support systems and development or creation of diversion programs must also be accomplished. Efforts for integrated continuum of care on substance use must be expanded. The implementation of mental health law provisions related to substance use must be subsumed by the primary health care capacities of governments to enable them to respond to rapid developments in organized crime and drug markets must be built up. We must strengthen responses to overcrowded closed-setting institutions and strengthen the role of the academic community in drug or substance use education. More importantly, of course, there is a need to sustain resources allocated for the drug campaign, especially for demand reduction and public health intervention activities. What policy direction should we take? Maybe it's time to look into institutionalizing incremental shifts from prevailing conventional policy framework on substance use towards adoption of compassionate pragmatism. It's a public health framework where persons who use drugs are at the center and when principles of human dignity are at the core of our foundations. We need to strengthen engagement with people-centered approaches with the inclusion of PWOODs, their families, communities, and other stakeholders. We want to expand interdisciplinary, integrative, multi-cross-sectoral approaches. Ideally, we need to also look into policies that prevent adverse health outcomes related to drug use, such as fatal overdoses, prevalence of bloodborne diseases, and other infections and drug-related deaths, including self-harm and accidental deaths. There is a need to build up voluntary mechanisms in providing substance use interventions and underscore restorative and transformative justice that deals with pretrial detention, mass incarceration, disproportionate sentencing, and others. On the current research needs, it is essential to generate evidences to support the policy shifts suggested previously. On your screen are just some of the issues we need to consider. One, to revisit conventional approaches to substance use and move towards a more public health approach. We need to generate evidences on the impact of global and regional developments in drug-related problems and how it relates at the local context. We need to look into the intersection of local realities, political, cultural, and others, and the developments on the drug market, money laundering, the use of online currencies, and the like. We also want to look at emerging trends on substance use and its public health implications. Of course, we need to unpack economic, social, cultural, and other factors affecting substance use to enable responsive matching of interventions and solutions. Improvements in monitoring and audit of existing programs or interventions, both at the national and at the local level, including assessment of its cohesiveness and responsiveness, will further identify implementation gaps. there is a need to look into the client process flow, detailing the client's journey, attrition between points in the continuum of care, the integration, progression from closed setting to community-based outpatient facilities, and more researches on community-based rehab and other local public health approach-based programs must also be done. Of course, we cannot overemphasize the need for more discourse and data on stigmatization and discrimination related to substance use. We also need to look towards developing an effective diversion system, intersection of substance use and gender, intersection of substance use and mental health. That's it. I hope I was able to capture all the recommendations, and thank you for your attention.
Okay. Am I on? Thank you, Undersecretary Reyes, for that comprehensive but succinct presentation. I know it's difficult to compress the discussion in just 15 minutes, so thank you for succeeding in doing that. Our open forum is going to be facilitated by academician Carmencita Padilla, a member of the NASD Philippines Health Sciences Division and focal person of this Science Policy Forum. She's also a 3-term chancellor of the UP Manila. Academician Padilla, the floor is yours, please. You're on mute, Academician Padilla.
Thank you very much. We have a lot of questions, so do I have 10 minutes for the questions? And I'll just choose the ones that have been outvoted in our list.
Yes. Undersecretary Reyes is still on.
Yes, can he be shown on the screen so that he can respond to the questions?
Yes, I'm here.
Thank you. Can we highlight Undersecretary Yusek Reyes, please? So we do have a lot of questions for you, but let me just share a couple of questions here. There's a lot of questions on whether these measures have been forwarded to the government. Can you just please assure the audience on how you're moving forward with these suggestions that you have shared with us?
Yeah, thank you, Ma'am Minkita. In fact, we have been discussing with our policymakers, both in Congress and in Senate, on how to first look into how we can amend the existing laws. Of course, our framework, as I mentioned earlier, is of course RA 9165, no? And we need to have those amendments in before the end of the administration. And in fairness, in both houses, the committees on dangerous drugs are helping us gravitate our policies towards a more public health friendly intervention approach.
Thank you. The next question is, how do you implement a mandatory random drug test in the companies? As you've said, it's a global pandemic. And can you make suggestions on how we were able to do this? Mandatory random testing in all of the companies within the Philippines.
Mm-hmm. The policy of DOLE, Ma'am Minkita, is actually to mandate a drug-free workplace program in occupational environments. No, drug testing is just one of the components that must be done. Of course, how they do it, they can randomize selection of employees. It's up to them. It also depends on the resources available on the company. So we are very flexible in implementing this one, and this program is also being monitored by DOLE. No, some of the local government units have required a drug-free workplace program before providing them with their permits, now business permits. But again, we are very flexible. And right now, we are also reviewing those said policies together with the Civil Service Commission for Government Workplaces. And for the private sector, we also want to involve ECOP and the business sector.
Thank you, Yusek Reyes. Can you comment on the community-based approach? How soon are we going to see this on a national scale?
Actually, we already have policies in place, ma'am, no, to have this implemented by all local government units in the country. As I mentioned in my lecture, more than 700 cities and municipalities are already implementing it out of the 1,400 plus local government units. But we feel that it can still be improved. We are looking at how we can also support highly urbanized LGUs, and maybe in provinces, no, the level of support must be defined per LGU. And again, it's a work in progress. We're just the board regulation number 7 was only approved 2019, and we're still learning as we pursue more intervention programs.
Thank you, Yusek Reyes. I've heard from you and our keynote speaker that there is a close collaboration between the private sector, the civil society, the academe, and government. But there seems to be a certain degree of anxiety from our audience. Can you just clarify, very briefly again, how are you working together, all sectors of society, to achieve the goal of a drug-free country? Yusek Reyes.
Thank you, ma'am. Well, actually, we have engaged with the faith-based sector. We have the Catholic Church helping us, the various religious sects supporting us. We also engage with several NGOs in the country. And let me assure you that we intend to provide healthcare services for all those assessed as having low risk and mild substance use disorders. So just to give an assurance to everyone that we are doing our best. And of course, we're, again, as I mentioned, we're still learning, and we're open to suggestions.
Am I on?
Yes, you're on, Academician Padilla.
Disconnect? Sino ba na-disconnect?
Ayan, ako yata, ma'am.
Go ahead.
Sorry. Did you get my my response, ma'am?
Yeah,
let me just assure everyone
yes.
that we're open to suggestions, no? But we have engaged with various NGOs. The Rotary Republic is helping us, civic organizations, faith-based organizations, and we welcome everyone's support. No, of course, government alone cannot implement such a big intervention program. But let me assure everyone, we're headed towards the right direction, and please help us.
Thank you, Yusek Reyes. There was a question about, I'm sure you've been monitoring the data in the country, and there's a question whether availability and price has affected actually the numbers of users in the country. Do you have this data to share with our audience?
Sorry, ma'am, can you say that again?
It's the effect of the price and availability. So which means, if of the drugs, whether it's affected the statistics that we have in the country.
Mm-hmm. I don't have the data with me, ma'am, but I was informed by PIDEA that so far, drug availability, accessibility, and price of drugs has not changed. As mentioned by Olivier and in my lecture, COVID apparently did not affect the availability of these substances. No? And so we call on everyone to still remain vigilant and help the government's effort to really address this problem.
Yusek Reyes, there's a question about the participation of the education sector. And you did mention that you're fixing the messaging that we're giving in the schools. Can you enlighten the audience about this plan on your end?
That's a very good question. In fact, we are working with DepEd, ma'am, now with USEC REBC. And we are set to implement the universal prevention curriculum. Of course, DepEd has their own prevention activities, but they are set to adopt the Colombo Plan and INL, International Narcotics Law Enforcement endorsed universal prevention curriculum. And we have been rolling out the curriculum for several months now. And we've also worked with CHED, the Commission on Higher Education, and together with our chairman, CHED chairman, I think they are now looking into the possible revisions of prevention modules at the tertiary level, ma'am.
Thank you. We still have a long list of questions, but allow me to just ask the last question, and then I will request Yusek Reyes to respond directly at the Q&A box. You mentioned about the PhilHealth package. Is there an update on this, very important component of your plans?
Correct, ma'am. We have been advocating for the development of the package since the previous administration pa, no? And so far, as far as I know, they already developed a package for detoxification procedures. And I was also informed that the Department of Health is currently reviewing other inpatient packages and outpatient packages for substance users. So hopefully before the end of the administration, ma'am, we will have better options.
Thank you. Well, thank you very much, Yusek Reyes. Please continue answering the questions that appear in box. And for those who send questions at Facebook, we will try to gather them and make sure that we are able to respond also. Maraming salamat po sa inyo.
Thank you, ma'am. Thank you.
Back to you, Academician Chong.
Well, may
Thank
I
you,
ask, Dr. John, Miss Joan, please. Thank you.
Yes, thank you, Undersecretary Reyes and Academician Padilla. To show our appreciation, we would like to present the following certificate of appreciation to our speaker, Doc Benj, or Undersecretary Benjamin Reyes. The Department of Science and Technology, NAST, and the ACDP present this certificate of appreciation to Undersecretary Benjamin P. Reyes in recognition of his invaluable contribution as resource person at the National Substance Use Science, Policy, and Information Forum, Substance Use in the Philippines, Governance, Research, and Practice, held on 15 June 2021 in Manila, Philippines. And this is signed by Academician Carmencita Padilla of NAST and Dr. Armand Crisostomo of ACDP and UP Manila. Maraming salamat, Yusek Benji.
Thank you. Thank you.
Okay. This concludes the first session of this forum. May I now call on Dr. Elmer Soriano of ACDP to introduce the next session, Public Health Dimensions of Substance Use. Doc Elmer? Okay, I think Doc Elmer is having a little difficulty. Our next speaker, let me just introduce our next speaker. Our next speaker is familiar to many of us. She's Dr. Clara H. Puderanan, the head of the Health Systems Development and Management Support Unit of the Dangerous Drugs Abuse Prevention and Treatment Program of the DOH. Dr. Puderanan is a psychiatrist and medical doctor. She's a training officer of the Dangerous Drugs, the DDAP of the Department of Health, and one of the content experts who conceptualized the training course. She is currently the head of the Health Systems Development and Management Support Unit of DDAP. Dr. Puderanan, the virtual floor is now yours.
Thank you very much, Ma'am Joanne. Thank you so much. And thank you to the organizers for having me here to present to you the summary of the discussions from the pre-conference webinars on the public health dimension of substance use. Okay, the key problems to be addressed are the following. Implementation of proper and effective community-based drug rehabilitation programs. As has been mentioned by Yusek Benji, we already have more than 700 CBDRPs all over the country at this point, but it's a work in progress. And of course, the integration of the community-based drug rehabilitation into the mental health program, knowing that mental health will involve not just the psychiatric and the neurologic disorders, but also substance abuse disorders. And tuberculosis management and treatment for PWODs in various treatment settings. It was found out in the research by Dr. Carl Antonio that the prevalence of tuberculosis in our drug abuse treatment and rehabilitation centers is substantially higher than the country prevalence, but is within the range reported for other congregate settings. Also, another problem to be addressed is to enhance the capacities and attitudes of health and service providers to ensure quality and empathic care for PWODs. This is not overemphasizing that there is a need to destigmatize addiction and also to support and funding for research areas related to substance use.
Dr. Clara, can we request you to make it in a presenter form? It's actually at the bottom, one option. That's it. Thank you.
Yeah. Why can't I do it for a while?
Another option is up there sa taas.
I'm pressing on the presentation for a while.
Slideshow. F5 down.
Excuse me.
Yes.
I'm sorry.
Can somebody assist?
I can't present it here.
Oo nga eh.
Yeah.
Okay, so we apologize to our audience, but there's difficulty making it into a presenter view. If the IMS can assist, please go ahead. But
Yes,
please
stop share, then share po ulit, ma'am. For the slide.
okay. Okay, ulit lang daw. Stop share lang daw po. Tapos
Yeah. Thank you. Somebody's assisting me also here. Thank you. Thank you. Hindi siya makapag-share screen.
Share again. Share your screen again, ma'am.
Hindi nagsi-share sa kanila eh. Share again. Share again. Siguro ito. Siguro ito. Uh-oh. So,
Better. Thank you.
okay. Thank you so much. Sorry for that. Hindi ko siya ma-move. Saan? Balik ako. Paano balik? And of course, let me continue with the key problems to be addressed. Of course, the support and funding for research areas related to substance use. So what should be the actionable points for the government? One is to support and monitor the existing community-based drug rehab programs in the country. And of course, there is a need to support proper management and treatment of tuberculosis among our persons who use drug population in the drug abuse treatment and rehab centers, or the ATRCs. There is a need to strengthen and conduct health needs assessment so that we could better implement the community-based drug rehab programs, and to strengthen, evaluate, and identify the best practices of the CBDRPs already existing, and to promote and ensure effective implementation. There is also a need to strengthen coordination between DATRCs and the TB DOTS facilities to ensure treatment compliance without actually compromising any DATRC protocols. Of course, we cannot do anything without the resources. Well, we need to allocate resources for capacity building activities for our implementers of community-based drug rehab programs. We need to allocate resources also for providing training to our staff in managing the tuberculosis cases in our rehab centers. Also, to include our PWOOds as beneficiary of free treatment from TB dots. As of the moment, there are those who get the treatment, the medicine from either the LGU, from the family, or from the TB dots. So we need to allocate resources for this. And also to increase campaign in raising awareness on drug use and dependence among health and service providers to promote positive and accepting attitudes towards PWOOds, and that means to allocate resources for destigmatizing addiction, and of course, provide training to our health and service providers to enhance their knowledge and comfort in taking care of our PWOOds or persons who use drugs. We also recommend to develop comprehensive guidelines for CBDRPs. Although we have already the DDB Board Reg 7 and DDB Board Reg 4, which gives a checklist on the guidelines for CBDRPs. We need to develop a more comprehensive one so that it will be so that our CBDRP implementers will be properly guided. So we also recommend integration of public health perspectives, including mental health in drug abuse interventions of non-health sectors. We recommend health financing and social health insurance coverage for CBDRP, as was mentioned by Yusek Benji. No? As of the moment, we have only a field health package for detoxification, but the Department of Health is working on the CPGs needed for the packages on the other levels of care. So we are recommending to create guidelines in the management of tuberculosis among PWOOds, a standard one in different treatment settings, and integration of our rehab centers in the TB Dots network, either as providing or referring facility. Of course, there are policy research gaps that we need to attend to. We need to examine the multi-level consequences of substance use. No, not just on the individual, but also on his family and of course the community. We need to develop tools to measure substance use prevalence and patterns. We have uh, we have a need to really make use of all the data that we are gathering now, especially during this administration, wherein there is a focus um, on this administration on how to prevent and treat and rehabilitate our PWOOds. There's a need to develop methodology and tools to evaluate the effectiveness of substance use prevention approaches and interventions. Although we are now encouraging and actively providing a universal prevention curriculum by our partners to our CBDRP and other rehab practitioners. And there is a need to examine the various factors in the successful implementation of these preventive and rehabilitative strategies. And we need to expand the analysis of drug supply and supply reduction strategies if we really want to really put an end to this drug problem in the country. We need to evaluate the different drug demand and supply reduction policies that we have at the moment. We need to investigate also the prevalence of tuberculosis among PWOODs in different treatment settings, because the one that was done by Dr. Carl was on residential facilities. So we need to investigate more in different treatment settings. And also, we need to determine the best practices on the case handling and management of tuberculosis among PWOODs. I think this is all that we have gathered during our pre-conference, and I hope I was able to summarize them well. Thank you very much.
Thank you, Dr. Clara Fudaranan, for the very insightful presentation. Dr. Fudaranan's presentation is a summary of our second pre-conference webinar that was held in April 28 on the public health dimensions of substance use. We now move on to our open forum, which will be facilitated by Academician Padilla again. Academician Padilla.
Thank you. Can I have Dr. Clara spotlighted? Okay, thank you. Thank you very much. Well, there are a lot of questions that have come out from your presentation, and you talked heavily about the community-based program, and you did mention that we need to study the factors for successful implementation. So the first question is, can you mention at least some models wherein we can say that we've had some successful programs at the community level?
Yes, thank you very much, academician Ma'am Carmencita Padilla. Thank you so much. Actually, yes, because during the start of this administration, there were proactive moves, no, from all sectors. So everybody was really motivated to do something about it, because there were a lot of surrenderies, as we call them, no, from the Tokrang that time. And therefore there were a lot of programs, and one of these that I could mention will be the faith-based programs, which was for us culturally, for Filipinos, this makes actually a big impact on our PWOODs, no, and it really helped them. And another model that was already approved by the DDB is the KKDK of the um, Philippine Association of Psychologists, or the PAP, which is a facilitation model that has been helping our PWOODs not only in the community setting, but also in enclosed facilities such as in our BGMP facilities. So these are very good CBDRP programs, ma'am, but there are a lot more. Thank you.
We have a follow-up question. So is there an update on legitimizing recovering people in the front lines of the programs to be accredited by the DOH?
Yes, actually, the CBDRP, according to our Board Reg 4, no, should be certified by the regional DOH offices, so that we will assure our PWOODs that the services being given to them and the program are evidence-based. So the regional DOH offices will be the ones to certify all the programs, even those existing programs before the Board Reg 4 was released. This will be presented to the DOH regional offices for certification, just to make sure that we have quality programs for our PWOODs.
Oh, thank you. That is very reassuring that that the Department of Health is on board. Can you enlighten on the issues on the tools that you mentioned? You said you had to develop the tools in monitoring the substance abuse and so on. So can you enlighten the audience about this strategy on your end?
Yes, ma'am. Thank you. Actually, we have already these programs, but there is a need to monitor and evaluate these programs for its effectiveness. And that's why the government now is coming up with new info system to gather all this data, so that we will be able to see the effectiveness. There will be monitoring of these programs all over the country. So DDB will be the repository of all the data, And of course, for the CBDRP, the ILG is the implementer of CBDRP, although the Department of Health provides the technical assistance. Therefore, the Department of Interior and Local Government has already come up with an info system which will be the repository of all the data from all our CBDRPs all over the country, ma'am.
So you were mentioning that the DDB is actually the repository of the, I'm sorry, am I still?
Pro- Ma'am, repository of all the data from all
Yes.
levels of care. So from the residential, non-residential, and also the CBDRP.
Okay. Now, there was a mention about the online tools. So would you like to comment on the use of online tools for your data gathering? Is this already being implemented right now?
What we're using now, we're working on the online screening of our clients, of our PWOODs, no? To be able to screen them for any comorbidities or screen them for the risk level of their use, we can do that online. And I will take this opportunity to promote that there is such a thing as substance abuse helpline 1550. You just dial 1550 for more awareness, for education on or for drug awareness, and also our agents can provide brief intervention, and they can provide the callers and the family with problems on substance use disorder to our treatment facilities all over the country, ma'am.
Okay, so just one last question again. There are many questions. Please respond to some of the questions in the Q&A box, and probably we'll send you some more questions from the Facebook Live. But on the integration of drug rehabilitation and mental health, one short comment about this.
Okay, very short comment. I agree with that. Being a psychiatrist, I know there is a need to integrate substance abuse with mental health. Although substance abuse program has been uh, already a few steps ahead of the mental health law, which was just recently passed. But I agree that there should be integrated because it is a brain disease. It is also a psychosocial disease, and therefore there is a need for it to be integrated into the mental health program.
Thank you very much. With that, thank you again, Dr. Clara, and back to you, Joanne and Academician Chong.
Thank you very much, ma'am. Thank you.
Thank you, Dr. Clara Fuderanan and Academician Padilla. To show our appreciation, we would like to present the following certificate of appreciation to our speaker. So the DOST, National NAST, and ACDP presents the certificate of appreciation to Dr. Clara Fuderanan in recognition of her contribution as resource person at the National Substance Use Policy and Information Forum held on 15 June 2021 in Manila, Philippines. And this is signed by Academician Padilla and Dr. Armando Crisostomo. Maraming salamat po, Dr.
Thank
Fuderanan.
you. Thank you so much, Ma'am Joanne. Thank you very much, everyone.
Thank you po. This concludes our session on public health dimension of substance use. The next one is on support systems for persons who use drugs. And okay, we were supposed to have a break, but we will no longer have that break. So we will proceed to the third session of this National Forum on Substance Use. Our session will now focus on support systems for PWOODs, or persons who use drugs. Okay, support systems are crucial for recovering individuals and communities. In this session, our speaker will be providing an overview on the different frameworks, best practices, and lenses through which professionals can provide support to those who are reclaiming their lives post-substance use. Our speaker for this session is Mr. Reniel Cristobal. Reniel B. Cristobal has been in the addiction treatment field for over 20 years. He has taken a professional in residence training program with Hazelden Foundation, Category 1 studies in addiction treatment at Harvard Medical School, special studies in treating on the addictions from the American Psychological Association, marriage and family therapy, and others. He's currently the executive director and founder of Family Wellness Center Foundation, Incorporated. Mr. Cristobal, the screen is now yours.
Good morning, everyone. My topic today would be support systems approach to treatment, recovery, and care. Okay. In the context of the Philippines, the issues around drugs, particularly illegal drugs, is widely discussed, no? Sa television, radio, and social media. In fact, it is also sometimes tackled as a political issue. Undeniably, drug use and legal drug trade have causes and social consequences. But what's mostly missing in public discussions, especially involving decision makers, is addressing the root causes of substance use and dependence, no? And even the involvement of Filipinos to illegal drug trade or drug activities. We rarely actually take time, no, in understanding the why. Why? Why is it that despite the harmful consequences of substance use and illegal drug trade, Filipinos still tend to be lured, no, into these risky activities? Okay. We mostly and almost automatically jump into conclusion that siguro itong mga adik wala lang magawa sa buhay or salot sila sa lipunan, okay? Misconceptions like, peer influence lang daw to, maybe they're bored, the free and independent choice, or that raid is the only way to solve the problem. Police raid and military raids of laboratories, okay? Or the problems are created by drug pushers and smugglers only. Or addiction is a moral failing, and that everybody are victims. So these are common misconceptions. Like I said earlier, drug use and dependence and illegal drug trade has social causes and consequences. Okay, and some of the examples I could give you are, for example, families and communities with low social capital and disorganized communities may perceive that engaging in risky behavior like drug use as normal. Okay, example: lack of opportunities for education, for jobs, making a living. It's a very, they become very tempted, no, to indulge in the illegal drug trade since mabilis ang pera, malaki ang kita. So as you can see in the slides, no, the vicious cycle: poverty, drug use disorder, to limited employment, limited education, so madali lang silang malure, okay, and then conflict, then paulit ikot-ikot lang. Also, of course, also the protective factors and the risk factors for substance use, no? So humihina yung protective factors, lumalakas naman yung risk factors, no, because of the substance use initiation. So these are the things, no, that we need to understand, if we will really be deciding to deal, no, with this problem. Everyone seems to have their own opinions, no, about drug abuse and drug dependence. Yun nga lang, no, except for the people themselves, no, who are directly affected. I think it's about time that we have to start listening to them. We need to start hearing their stories, no, of what they're going through, and and ano yung hardships na experience nila. And from there, we might really understand, no, how to help these people. So why do people turn to drugs? Yun ang karamihan tanong. Drug users turn to drugs because to some it is a form of temporarily organizing an otherwise disordered life. Having heard at least thousands of stories, over the years, through my clients and even some friends, no, na eventually drugs was able to rule their lives. Okay? Kaya parang nagiging temporary ano siya, coping mechanism. Another one is loneliness, since because addiction is an isolating disease too, people do get lonely. They they get sad, no? They feel sad and fear. Nagiging fear-based sila. That's the reason why I'm mentioning this is kasi it is so important for us to be able to make them feel that they're not on their own, that we're here to support them, and that we're not here to hurt them. So for me, those are very important things, to remember. Now, uh, there are ways now today that we see that can help them organize life without psychoactive substances. Okay, like faith, religion. Okay, we've seen faith-based programs that are very effective. Bible studies that helps people abstain and be able to continue their abstinence. Self-help groups like Narcotics Anonymous and Alcoholics Anonymous. New friends, non-using friends, are really good ways, New environment, a new place, new creative challenges, and or a combination of all. So, how do we help them organize life without psychoactive substances? We need to start helping these people, okay, find how they can start feeling internal empty spaces in their lives, in themselves. We need to help them find a purpose and a direction, in life. And the more they actually develop this, the more nagiging less high risk sila, in going back. So, what is recovery? Recovery is a process of change through which people improve their health and wellness. They live self-directed lives and strive to reach their full potential. Okay, that is what recovery. Recovery is not just abstaining from drugs, but of course that's the first step. Now there are 4 dimensions that support recovery. Okay, first is community. Ang sabi nga natin, bumabalik sila sa community, no? So they have to have a relationship, good, healthy relationships that supports recovery, social networks that provide support, friendship, love, and hope. Okay. Second is home. No? They have to have a stable and safe place to live. Okay. Health. Make informed, healthy choices that support not only physically but emotional well-being. And the last is the purpose. We need to help them have a recovery support approach that gives them meaning in their lives, a purpose. So meaning having a meaningful daily activities, independence, income, resources, and being able to participate in society. One of them is citizenship. Okay, we need to help drug users or drug dependents, these people, the mga PWODs, to be able to be productive members of the community and society. And the more they experience this, the more they will feel that they are part of an environment or of a community. And that's what we call citizenship. Now, we have also what we call recovering-oriented guiding principles. Okay? One is recovery emerges from hope, that there is hope. We need to start helping these people believe that there is always hope, that they will not die as drug addicts. It has to be a person-driven. Recovery is person-driven. We need to help them have a drive in life, have a meaning in life. Recovery occurs via many pathways. Hindi lang po religion, hindi lang treatment program. maraming pathways na pwede silang puntahan or daanan. No? Recovery is holistic. No? It's not only medical, but it's environmental, it's social, it's spiritual, okay? It's psychological. Okay? Fifth, recovery is supported by peers and allies. Okay? Kaya meron tayo tinatawag ng mga peer support group. We need to help them be part of a peer support group. Okay? Six, recovery is supported through relationship and social networks. Seven, recovery is culturally based and influenced. Eight, it has to be supported by addressing trauma. Okay. And nine, recovery involves individual, the family, and the community. You know, yung strength nila and yung responsibilities nila. Kaya nga, part ng program ng DSWD is, diba, yung dimensions. So, kailangan may mga dimensions sila, individual, the family, the community. And 10, recovery is based on respect. You know? Now,
Okay, I think, yes, that was the presentation of Mr. Cristobal. Thank you very much, Mr. Cristobal, for that engaging presentation. I think there were a little more slides to it, but because we're a little over time, we will proceed to our open forum, which is going to be facilitated by Academician Padilla. May I once again invite Academician Padilla and Mr. Cristobal on screen.
yeah.
Can I have Mr. Cristobal spotlighted?
Hi, good morning.
Thank you. Magandang umaga po. That was a different kind of presentation because it really completes the picture now for the workshops that you've been having. There are a couple of questions I'd like you to respond to. I don't think you'll be able to ask all of them, but you did talk a lot about recovery and the different pathways. So I'd like to ask you the first question of, how do we ensure that the community is ready to accept them or the home is ready to accept them?
Well, I think for the community, the first thing that we really need to do in the community is education. So we really need to start coming up with psychoeducation programs, not only for the PWOD, but for the community. When I say community, it could also be the family, included na the family. And also we also notice, karamihan ng struggle and challenge sa community, hindi lang yung family, but minsan yung local government, yung mga nandyan, kasi iba-iba yung pagkakaintindi nila So I think for me, it's very important na iisa yung pagkakaintindi. Kung hindi, people will have different approaches with the PWODs when they get back to the community, and sometimes it gives more of it gives more challenges to everyone.
From your presentation and even the prior presentations, the role of the LGU is very important. And there's actually a comment in the Q&A box about the budget that's being allocated. So who dictates the price that should be, allocated to this problem? Can you comment, Mr. Cristobal?
Oh, well, I'm not so familiar with the, I'm not so familiar with the process sa LGU, but I really don't know the exact budget that they need. But what I can say is, sana prioritize talaga nila, to put a really good budget for education, even making materials that they can give in the community, mga small literature materials, that would really help. Maybe put it in Tagalog, so, maintindihan ng lahat. So, para mawala din yung stigma, yung stigmatization.
So the next one is a follow-up question. How do we ensure that the LGU is on board? Because it seems like recovery and integration is going to be a dependent on the LGU involvement on our clients. Who is monitoring the LGU engagement?
Well, I I'm not so familiar, no, but what I know is DILG is also on top of the this they're the one in charge, and I'm part of this project now with DSWD. I think DSWD and DILG and DOH are working together, no, for this, and the PNP, are also working together to how to help the community, how do you call it, get ready, for what we call reintegration, ng mga PWOODs if they come from the either rehab centers or the community-based programs. Okay? So it's really preparing. No? Yeah, we really need to start preparing them.
That's why I said your presentation actually, brings home the message that even if the community is not ready, the integration is going to be very difficult. So with that, if I may just ask the last question, because we have to move on due to time constraints.
Yes.
In terms of the productivity again, from the thousands of stories that you've heard, how many of our clients, our patients, eventually felt that they were integrated into society? Just from your personal experience within your group. Mahirap pa.
Yeah, mahirap. No, I really don't have the exact the exact statistics. But what I would like to only share, as before we part ways, is, sana we have to start listening again. We have to start listening to the PWOODs, no. Not only, I always hear, people talking about the law. Okay, but that's fine, no. I mean, I have nothing against that, or the medical approach and treatment, but I think it's also about time that we have to start listening to the PWOODs themselves, so we will really, know what they really need, what they're going through, and then let's come up with interventions according to the things we hear from them. Their stories have so much information that we would know. Minsan nakakaligtaan natin sila, no? We just get to focus on the medical aspect. We get to focus on policies and laws. Again, I have nothing against that, but that's very important. It's just that maybe we also need to listen to them. And last. I think we also need the help of the media. No? The media, to start actually delivering message of hope, no, sa publiko. Hindi lang yung mga addict pumapatay, massacre dito, tokhang doon, I think we need to start giving the message of hope, no, that people do recover, that addicts doesn't have to die, they can always get help, and maybe, just maybe, we can start motivating them to seek help.
Well, thank you, Mr. Cristobal. That's a perfect way to end this section, because we're ending with a lot of hope, and we do have some media in the audience. I encourage the panelists, not just you, but the rest of the speakers before you, to please answer some of the questions at the Q&A box. Maraming salamat po sa inyong lahat. And yes, Mr. Cristobal, we will continue to listen. Maraming salamat, and back to you.
Maraming salamat din po. Okay,
thank you, Academician Padilla and Mr. Rechi Cristobal. To show our appreciation, we would like to present the following certificate of appreciation to Mr. Cristobal for his contribution to this forum. So again, the DOST, NAST, and ACDP present this certificate of appreciation to Mr. Rechi Cristobal in recognition of his invaluable contribution as resource person at the National Substance Use Policy and Information Forum in June 15, 2021. This is signed by Academician Padilla and Dr. Arman Crisostomo. Maraming salamat, Mr. Rechi Cristobal.
Thank you po. Thank you.
Thank you. All right. We will now proceed to the next session. And I call on Dr. Elmer Soriano. Please go ahead, Dr. Elmer.
Our next topic is the science of substance use, and we will have two speakers. Our first speaker is Dr. Gail A. Gomez, who will be discussing the biopsychological perspectives on substance use. Dr. Gail Gomez is a psychologist and associate professor at the Ateneo de Naga University. She's also the chair of the Substance Use, Prevention, and Recovery Special Interest Group of the Psychological Association of the Philippines, PAP. PAP is one of the co-conveners of the Asian Center for Drug Policy. She will be followed by Dean Leonardo Estacio Jr., who will be discussing the socio-anthropological perspectives of substance use. Dr. Dean Estacio is a professor at the Department of Behavioral Sciences at the UP Manila and currently Dean of the College of Arts and Sciences at UP Manila. He teaches anthropology, behavioral sciences, and health policy courses at undergraduate and graduate levels. He completed his PhD in anthropology at UP Manila and his master's in public health at Johns Hopkins University. He has been a visiting scientist at the University of Washington and has been a recipient of the U.S. government's Hubert H. Humphrey Fellowship Program. Apart from being awarded as an outstanding teacher by his college, he has also been a recipient of the UP Manila Chancellor's Award for exemplary extension work for public service. Ladies and gentlemen, let's give both of our speakers a warm round of applause.
Good morning. For our cluster on the science of substance use, we wanted to establish an understanding of the science of substance use from various disciplines. This knowledge could contribute to the development of further interventions as basis for policymaking and to address research gaps. Based on the brown bag sessions, we gathered this for the biopsychological perspective. In line with the actionable points from the governance POV, the following are in need of support and strengthening. We recognize the important role that triggers play in encouraging people to engage in substance use, whether personal or environmental. So, there is a need for more programs that would help in furthering knowledge or understanding of these triggers which lead to substance use and its effects. Understanding substance use will also allow people to see the importance of help seeking and avail of treatments and interventions that are available. By knowing that community-based drug rehabilitation or CBDR offers a big potential to provide skills in coping and enhancing family support, thus the importance of implementing this. We are happy to share with you that the program Katatagan, Kalusugan at Damayan ng Komunidad or KKDK through the efforts of the PAP and the USAID Renew Health is now a recognized model for CBDR by the Dangerous Drugs Board. Due to the stigma attached to mental disorders, the need for treating this is underestimated. And there are periods who have comorbidities with other mental disorders. Therefore, a need to consider not only screening for substance use, but also mental health assessments for those whose drug use are prolonged due to mental health conditions, such as depression, anxiety, and the likes. Thus, an integrated care is also essential to address this matter. There is also a recognition of the shortage of personnel or human resource in treatment and rehabilitation centers or TRCs. There is now an increasing number of drug users among young populations. Therefore, there must also be a move towards evidence-based treatments for adolescents. To thoroughly apply client-centered approach, TRCs need to strengthen monitoring and follow-ups on individual clients. For treatment centers, such as Bahay ng Pagbabago, the need to improve the effectiveness of random checks on persons who are recovering from substance use with informed consent to emphasize human dignity. There's also a need to enhance physical and health wellness programs. In consideration of promoting holistic approach to treatment, we consider Filipino culture and spirituality. So in Bahay Pagbabago and other treatment centers, there's a need to enhance the spiritual development by holding daily mass and other spiritual related activities. To achieve this, the following resources are thus deemed necessary. For the general population, more educational programs and advocacies to widen the scope of audience in terms of drug education. More youth might be reached if drug education can be integrated in the curriculum. For the P-Woods, more educational and economic programs that can help them in moving away from substance use. A thorough understanding of substance use and that a one-size-fits-all approach is not helpful would acknowledge the need to allocate for human and other resources that would meet the client-centered approach to treatment and recovery. For TRCs and CBDR, apportion resources for repair of facilities and improvement of programs. In recognition of the reality that the support of family is very crucial to recovery, funding of existing programs is needed to continuously provide solutions for persons with substance dependency, including their family. So our recommendations for new policies would include consider doing more investigations on the impact of treatment interventions such as the KKDK, thus more fund allocations for more collaborative and evidence-based research that would be directed towards policy making and program development. Treatments implemented by TRC should also emphasize the science of substance use. A move for creating a separate policy for adolescent clients or that which also considers their developmental span, their nature and dynamics. Further investigation of the effectiveness of treatment to come up with more evidence-based interventions. A more integrative approach to care by putting together substance use and mental health services to address comorbidities among P-Woods. The effectiveness of integrating in treatment services, drug recovery skills, life skills, and family interventions has been noted, especially in the delivery of the KKDK program. Thus, a policy that would consider these points to treatment must be in place. Then opt for a more sustainable aftercare program that P-Woods might really appreciate because these are according to their needs. In line with the actionable points, the following are the existing policy research gaps that need to be addressed. More research efforts must be spent in understanding prevention of substance use so that these might be considered in the design or creation of intervention programs. To address the complexity of substance use, experts can collaborate more to contribute to a multidisciplinary view of the problem. further investigation and appreciation of the effectiveness of psychological, social, and cultural nuances for better understanding of substance use. Understanding the factors that contribute to unsustainability of aftercare services that could eventually lead to relapse. That is all for the biopsychological perspective. Thank you very much.
Good morning, everyone. I am Leonardo Estacio Jr. from the College of Arts and Sciences, UP Manila, and I'm happy to share with you the socio-anthropological perspective on the science of substance use. I'd like to thank the National Academy of Science and Technology, the Asian Center for Drug Policy, and the University of the Philippines for this opportunity. In line with the aims of this forum, I'd like to grapple with these three very important questions. Question 1, what existing evidence on prevention, treatment, and care for people affected by drug use and drug use disorder that employs rights-based approaches can we learn and gain from socio-anthropological related research? Question number 2, what can sociology and anthropology contribute in the discourse on substance use? Question number 3, what evidence-based policy recommendations to national and local policymakers can we draw from socio-anthropological studies? Unlike sociology, it is being claimed that anthropology is a late arrival in the multidisciplinary research on substance use. Nevertheless, it has provided these three explanatory models as modes of inquiry. The cultural model, which looks at substance use as part of culture, a way of life, not disruptive, but done for social solidarity and recreation. The lifestyle model, which treats substance use as way of survival, a part of the subculture. The critical medical anthropological model, which situates substance use as a way of control, a tool for power on one hand and a lived experience on the other. These three tools provide traction for anthropology in creating an impact as a scientific enterprise in the substance use field. Anthropology employs the power of anthropological model using comparative and holistic research in drawing out hidden truths and meanings in human behavior and putting into context, connecting the dots, so to speak, to ferry out the truth in any phenomenon being studied. This works best in high-risk research where anthropologists are known to be risk takers, going in far-flung places and dangerous areas to conduct research. In the substance use field, particularly in the area of illegal drugs, the anthropologists are known in conducting what Hosson and Sakaran calls mapangahas na panaliksik or insurgent research. Their mantra is to get the lion's cub, one should enter the lion's den. That's the power of ethnography, a tool used by anthropologists in conducting fieldwork or participant observation. Substance use is not well explored territory in sociological and anthropological research. Here in the list, I have cited some of those pioneers and eminent researchers in this field. For example, Professor Sarko, who did a pioneering work really in the drug abuse field. No? He has written a short history. Actually, this is a book, a short history on narcotic drug addiction in the Philippines. And academician and Professor Emeritus Michael Tan has done a lot of work in the substance abuse field, both in studying licit and illicit drugs. And he has written a lot of articles also in his column in the Philippine Daily Inquirer about issues that concerns substance use. And of course, we have one young medical anthropologist, also a medical doctor, who is a prolific researcher and who has done also ethnographic work of male urban poor youths in the Philippine port community on drug use. And a colleague, a dear colleague from the Ateneo de Manila University, Professor Emma Porio, has done a seminal work in making research on the use of children in illicit drug trafficking. And Also, young anthropologists, Hobson and Sakaran, exploring the use of mapangahas na panaliksik tungo sa pagbuo ng kaalaman at katatagan sa gera laban sa droga. There's a dearth in terms of looking at the contribution of sociology and anthropology in the substance abuse field. So here's a short list in substance use research that is worth sharing. Of course, there are other researches, but in the interest of time, I have listed here researches where I am directly involved, either as a lead researcher or a collaborator. And let me go through them one by one. So this research, Bawal na Gamot, Exploring Contradictions and Connections in an Urban Barangay, attempts to look at the dynamics of drug trading and drug taking in an urban community. And from this research, I was able to gather useful data on the epidemiology of drug use in the barangay and documented the vicious cycle of shabu trading and shabu taking as underground political economy, and provided useful data and how users fall into shabu addiction. From this study, I was also able to publish a theoretical and advocacy paper that recommends a developmental approach aimed at turning drug vulnerable communities to drug resistant communities through community organizing and community development projects as drug resiliency measures. The next one, the primary prevention of ATS abuse among youth in the Philippines, where I was involved as also part of the research team, assess the level of knowledge, attitude, and behavior of the Filipino youth on ATS, shabu and ecstasy, and from this designed and developed health promotion and communication strategies and materials to educate the youth from the harmful effects of drugs. From the research, we found out that the increased knowledge of the harmful effects of drugs, of the drug law, and developing a strong anti-drug attitude influence increase in protective factors. Good outcome of the research, it was used by the DDV as scientific basis in the creation of the Barkada Contra Droga, a national flagship program for preventive education and drug awareness campaign, which was created in 2004 and instituted in 2007. The next one is the use of children in illicit drug trafficking, which is done by Professor Imaporio of Ateneo Manila and her colleague. I was part also of the research team. And this participatory action research investigated how children were exploited and used as drug couriers. And from the findings in this research, a community-based drug demand and supply reduction program for children and youth were designed and implemented. This included peer counseling, responsible parenthood, youth organizing, and implementing recreation against drugs, talents against drugs, and including after-school tutorials. The project was a success, but short-lived because it was not sustained by the barangays. This next project, an addiction recovery project for the grassroots in the Philippines, was actually funded by JICA and the Asia Pacific Addiction Research Institute, and was implemented as a response on the need to provide cost-effective treatment services for persons who use drugs that cannot afford the prohibitive cost of private and government treatment facilities. So the Alcoholics Anonymous and Narcotics Anonymous recovery meetings were conducted weekly among 10 persons who use drugs as volunteers to the program, and it was facilitated by the Family Wellness Center managed by Mr. Richie Cristobal. From the outcome assessment that was conducted, there was a 4/10 success rates, meaning out of the 10, 4 really quit drugs after the pilot test. And the findings showed that the AANA approach will work only among the low income group if it is matched with other livelihood activities. This next project, entitled Drug Use and Behavioral Health Among Young Populations in Metro Manila and neighboring provinces, a baseline income intervention study, is collaborative research that was funded by the Emerging Interdisciplinary Program of the University of the Philippines. This baseline com intervention study aimed to gather best practices in treatment and rehabilitation from private and government treatment and outpatient facilities to be used in the design and development of community-based drug treatment and recovery program among persons who use drugs. From this data and additional data from community volunteers, an evidence-informed community-based treatment program called 6Ps was designed and developed for pilot testing to 56 persons who use drugs from 4 barangays. The outcome assessment yielded promising results on self-efficacy and drug resiliency among the participants. Those that turned positive at pre-test turned negative at post-test. However, some that were negative at pre-test, particularly those that used Shabu, turned positive at post-test. The reason being that they failed to attend regularly the sessions because of personal concerns. Findings of this study showed that those that attended and completed at least 3 modules and sessions were more likely to have higher self-efficacy than those that attended only 1 or 2 modules. However, the study is not conclusive, so further tests should be done to strengthen the findings. With the good results, the city government, where the intervention study was conducted, passed a resolution adopting the program for all barangays. However, because of the COVID pandemic, the implementation of the program was deferred. So these are just some of the pictures that documented the series of activities. You can see here that there's also even an activity where a grooming session was done. And we also work with an NGO, INAM, that introduced ear acupuncture as a possible treatment for substance use. The next one, assessing the drug use and behavioral health of adolescent substance drug users in the Philippines, moving toward a culturally appropriate and age-specific treatment response, was a study that emanated from the comprehensive evaluation of accredited DOH-TRCs done in 2016 to 2017. From the data gathered, only 1 out of 10 TRCs provided treatment program for adolescent drug users. Similarly, only 2 out of the 10 TRCs had treatment programs for women. Findings of the study showed that there are no specialized treatment services for adolescent clients, and they underwent the same treatment interventions with adult men and women, except for the alternative learning systems. From the study, the administrator himself argued that adolescents are in that stage of their life course where they experiment a lot and where they are in their most adventurous and challenging period in their lives. The study recommends that an age-appropriate specialized treatment approach be designed for them. And finally, this project responded to the need by the treatment and rehab centers to have a more programmatic and responsive aftercare program. The research project gathered culturally appropriate and cost-effective strategies being employed by treatment providers from 8 government-run TRCs and used them in developing a culturally appropriate and cost-effective aftercare program. Labeled synergistic interventions based on life skills enhancement or CBOL, the manualized aftercare program has 2 versions, original version and telehealth versions. This was because when the original version is about to be pilot tested, the COVID-19 pandemic emerged. Thus, a telehealth version was produced. Guided by the assumption that clients, participants provided with responsive aftercare that is culturally appropriate and cost-effective will engage in fewer risky drug use and lifestyle behaviors as measured by the primary outcome measures of the number of relapse cases during the first 90 days, 3 months, prior to the 6-month and 9-month follow-up assessments. CBOL was pilot tested for cultural appropriateness, cost-effectiveness, and treatment effectiveness following the 3-stage psychotherapy research, pilot testing, efficacy trial, and replication trial. But at this stage, we are only doing the pilot testing, and we have just completed the 3rd month endpoint. The intended treatment outcomes of CBOL aftercare intervention were as follows. At the end of the aftercare treatment program, the clients are expected to avoid, resist, or prevent the use of drugs and substances, improve significantly their spiritual, physical, mental, and behavioral health, improve their social relations with their family, friends, and significant others, improve significantly their self-efficacy, productivity, and livelihood skills, improve their community relations and their integration, and for the treatment providers to have effectively used culturally appropriate, socially acceptable, cost-effective, and efficacious intervention strategies and approaches toward recovery. From the outcome assessment of the 3rd month endpoint, the aftercare program was found to be high in cultural appropriateness, cost effectiveness, and treatment effectiveness, and it is being recommended for adoption by all the participating TRCs, with a caveat that further testing and refinement should be undertaken. The project is an example of collaborative effort by the TRC clients and their families, treatment providers, DOH, PCHRD, researchers, to develop a truly Tatak Pinoy aftercare program for recovering drug dependent. So in summary, I have shared existing evidence on prevention, treatment, and care for people affected by drug use and drug use disorder that employs rights-based approaches, namely policy advocacy research on the bawal na gamot study, prevention research on amphetamine type substances, where it was used as a scientific basis in the creation of Barkada contra Droga, the treatment research for the 6Ps, and the AANA treatment approach, the aftercare research, the CBOL aftercare program, and rights-based research on adolescents and the use of children in drugs. Now, what has been the contribution to the discourse on substance abuse of the socio-anthropological perspective? Well, from what was shared, it can be inferred that the socio-anthropological disciplines provides holistic transdisciplinary perspective of the phenomenon. It encourages collaborative research, whether transnational or interdisciplinary or multidisciplinary. And it also supports the use of mixed methods research. We have seen the participatory action research as one of the highlighted mixed methods, also combining epidemiology and ethnography. The socio-anthropological field also advocates evidence-based and policy-driven research. Likewise, culture-sensitive, cost-effective, humanistic, and rights-based approaches. Likewise, culture-sensitive, cost-effective, humanistic, and rights-based approach in dealing with the substance use problem, and supports the development and design of Filipino Tatak Pinoy models of promotion, prevention, treatment, and recovery on substance use. So what are evidence-based policy recommendations from what has been shared? In line with the actionable points from the governance point of view, the following are in need of support and strengthening. The shift to community-based and community-directed approach in promotion, prevention, treatment, recovery, and control. And of course, under this, the need to expand the preventive education and information program, the national flagship program, Barkada contra Droga, the strengthening of community-based drug rehabilitation policies and programs as they reduce substance dependence and enhance coping behavior and family support, the strict integration and continuation of social support systems on the recovery of recovering drug dependence, the design and development of evidence-based, standardized, policy-driven, culturally appropriate, cost-effective treatment and rights-based CBDRs, just like the KKDK, 6Ps, CBOL, and other manualized program developed by other groups and agencies that needs to be shared. And finally, sustainable funding support to anti-drug abuse councils, the Barkada Contra Droga, and community-based drug rehabilitation programs, among others. Also recommended is the improvement of the residential outpatient treatment services, a development of a specialized treatment program for different substance dependency groups based on age or gender, the development of also programmatic capacity enhancement or professional development program for treatment and service providers, and more government funds for TRC personnel, facilities, and programs and services. Likewise, there's a need to shift from retributive justice to restorative justice policy framework, such as the delisting and the stigmatization of persons who use drugs, and the strengthening of public health, behavioral health, harm reduction, social development programs informed by rights-based policy framework. There is also a need to strike a balance in terms of funding and implementation of demand reduction and supply reduction programs. More opportunities for capacity enhancement in substance use research and interventions should be provided, like the training program for service providers across, in all areas, promotion, prevention, treatment, and rehabilitation, recovery, among others. And also the need to develop short-term courses, graduate degree programs, and research fellowships. And finally, more programmatic, sustainable funding for substance use research. And to end my presentation, I'd like to quote this: "Science is not the truth. Science is finding the truth. When science changes its opinions or findings, it doesn't lie to you. It learned more." Mabuhay po kayong lahat.
Thank you, Dr. Gomez and Dean Estacio. Our open forum will now be moderated by academician Charlotte M. Chong.
Well, thank you, first of all, to the two distinguished speakers for this forum on the science of substance abuse. I think there are a few questions only in the chat box, and if you have questions, please type them in the Q&A so that we can ask them. I think I'd like to be able to start the ball rolling by asking Dr. Gale, who talked about the biologic basis of substance abuse. Have you been able to determine the genetic factors that might be responsible for some of these substance abuse or substance use disorders or conditions? Dr. Gale? Wala na po siya.
Good morning. Good morning po. I'm speaking on behalf of Dr. Gale.
Okay,
I'm Dr. Homer. I'm a psychologist, and for the biological perspective, as of now, I'm not really sure about that. But of course, when we talk about these drug problems, there's always the possibility of the genetic component. So perhaps our co-panelists can answer that, who are in the medical profession. But that's always a possibility under the biological perspective.
Would you want to say something, Dr. Estacio?
Well, of course, there's always a biological basis of human behavior, citing the evolutionary framework, and informed by genes. No? Just for example, if the genes are the building blocks of our biological traits, memes are also the building blocks for cultural traits. So magkahugpong po yan eh. So but then of course advancement in the knowledge of substance use using mostly neuroscience, no? So they're trying to reduce it as a brain disease problem, and so no, they're tracking the neurotransmitters as the culprit, no? And well, that's of course a feasible one, but of course there are epigenetic causes also. That's why in anthropology there's this new field, we call it neuroanthropology, where we say that there is such a thing as incultured brain, so we are now in the process of merging perspectives. I think there's a need to synthesize now. Let's not work in silo. Let's put together. That's why we are pushing for a transdisciplinary, interdisciplinary, or multidisciplinary, treatment of the substance use problem, so that all hands on deck, all heads on deck, we can probably arrest the problem.
Yeah, I think thank you for that framing that, Dean Dr. Estacio, because we, of course we come from the academe, and we would like to see whether from a perspective of science we may be able to find some heritability of some of these substance abuse and be able to see whether there's something that can be done about it. We, of course, the social anthropological view that you've shared with us is very important. And the fact that adolescents who are actually able to have the substance use initially become chronic users of these substances. And I feel that from a social-cultural viewpoint, mahilig ang Pilipino makisama. Sa atin, ang kapatiran at pagsasama ay napaka-importante. At siguro ay kung titingnan ko yung ibang nakilala ko na may substance use po, na malapit sa akin, pag nakakausap ko sila ay ang sinasabi nila, bata pa sila, teenager pa lang sila, nila nalaman na ito palang substance use ay maganda at ito ay nagbibigay sa kanilang saya kahit na pansamantala lamang. So, based on your studies, kung ganun po ang origin nito, palagay niyo po ba ay ano yung pinakamagandang intervention na pwede nating gawin as a community of scholars para matulungan natin itong problema ng substance use?
Yeah.
Yes,
I think
you both can talk. Yes.
Okay. I think that's also the rationale for our cluster, that we have to approach this problem using various disciplines. As a psychologist, when I started practice about drug rehabilitation, I noticed different realities. For example, yung mga sinasabi ni Dr. June, social aspects, cultural aspects, yung barkadahan. One big factor yung barkadahan, no? So, na-rehab siya, pagbalik sa community, nandun pa rin yung peers. Paano na ngayon, no? So, it's really a total approach that we really have to recognize these various approaches to really be effective, and of course we check the effectiveness of our interventions. Kaya we have to continue the dialogue sa research, policy, and also sa intervention level, evaluation level. Dr. June?
Yeah, well, if we go by evidence-based data, diba? Sometimes tinatanong kasi natin what are the risk factors, or what lead you to use drugs? Ano yung unang naging dahilan bakit ka nagdroga? At tumalabas, barkada, problema sa pamilya, curious ako, nabore ako. So you look at that and di ba, makikita natin na the drug problem is not just a problem of the drug itself. It's a problem of social relations. So it is socially induced and meaning driven. Diba? So therefore, kung titingnan nyo, barkada yung nag-induce, so socially induced. So therefore, anong mahalaga dyan? But we now know that the drug problem is controllable. Diba? You can resist, you can evade. Diba? Yung sa support system na sinasabi kanina ni Richie, pwede kang umalis, pumunta ka sa ibang environment. Yun yung isang ano doon. So let's not take away that thing. And then of course, I think it's high time for us, meron tayong tinatawag kasi na case management when we look, kasi iba-iba yung pinanggagalingan ng problema niya. Diba? Kung barkada yung nag-influence, di dapat, there should be a routing of the problem. Just like the way medical doctors diagnose the condition, health condition, di ba? You should locate the problem. Kung barkada yung di barkada, pero minsan pamilya eh. So you cannot encourage the family therapy, the family to be the first line of defense. Diba? Kasi yun pala yung dahilan. So we need to define, root the cause. Kaya dapat din yung mga engaged in psychotherapy or behavioral therapy, dapat alamin ano yung nagtulak sa iyo sa unang bugso sa paggamit, and work it from there. Hindi pwedeng generalizing, totalizing yung ating intervention eh. That's why we encourage individualized treatment plan, just like the way also medical doctors do it, di ba? Kailangan may kanya, pag kumonsulta ka at na-diagnose, dapat yung treatment magkakaiba. Ang problema, we try to do a totalizing solution to the problem. That's one. But of course, we also recognize that it's a social problem. So and sometimes because of improper socialization nga, maling barkada eh, improper socialization, and then meaning driven. I did some work on looking at the decoding the language of drugs. Bawal na gamot. Gamot siya pero bawal. Ano yun? May dual properties. So therefore, and then when I did my ethnography, I found out na meron dalawang klase ng user. There is this what we call wise user and I was unwise user. Pero yung ginagamit yung gamot, there are the gamot seekers and bawal seekers. And we are not using those data in terms of doing our work. No? So that is important. We are not. It's high time that we really use science, no,
Yes.
to influence policy and programs. But then, I hope that our policymakers will consider now what we are trying to do. We are reaching out to them, to also, as Fauci said, why follow the science, no matter what, even if it hurts.
We have a staggering problem on drug use, substance abuse, as was mentioned by Mr. Olivier Lemay. The incidence of substance use, especially with amphetamine, is very high. If we're talking about more than 1 million, 1.7 million Filipinos using these drugs, that's really a phenomenal problem. But again, in the communities, we also know that the implementation of how drug prevention can be done is they're using police force, no? They're trying to arrest them, and some of them get incarcerated. And incarceration is really a very problematic because our prisons are really crowded, and sometimes it becomes even more problematic for our drug users. So it's a big problem, and it's like ano ba talaga yung tamang approach? I've also heard of policemen who are given quotas. Kailangan makapag-arrest po sila ng ganito kadami. So hindi ko alam whether there's a scientific basis for this system of preventing supposedly drug abuse or containing the drug abuse problem in the Philippines. So tama po kayo. We believe that it's a whole of government approach, whole of nation approach, whole of society approach that we probably need in order to lick this problem of drug use or substance abuse. Ang tinitingnan ko na lang po ay yung mga tama si Mr. Cristobal, sinabi ka na, we have to listen to them. So we feel that we probably really have to do a lot of researches to find out what is actually and try to categorize the different drug users and different age groups and different groups basically, because sabi nga ninyo, there are several dimensions that we look at, not only the scientific basis, maybe the scientific basis in terms of genetics, in terms of wanting to have risky behavior, in terms of having this cognitive for a thrill, in terms of being able to look at the positive enhancers and the negative enhancers that are really basically wired in a person's body, no? So palagay ko nga po, we need more research that should be able to do this. And how do you think government should do this? Kayo po as a researcher, Dr. Stasio or Dr. Yabut, nabibigyan ba kayo ng tamang suporta? What else do you think you need?
Well, sa aking pagtingin na din siyang academician siyang ay saan ba mas manageable yung problema? State level or community level? Saan mo ba mas makokontrol, mamamanage yung problema, masusupervise yung problema? State level or community level? Yun lang eh. Diba? If we direct all our efforts at the community level, strengthen the anti-drug abuse councils and all, let's do community organizing, family organizing, back to our culture, bayanihan, damayan.
Tama.
So, yun ang tingin kong tamang solusyon eh. That's why I was saying that baka kailangan na ganun ang gawin natin. Mag-shift tayo talaga ng paradigm or focus. Let's go back to the community kasi nandoon naman yung problema. That's why I presented the dynamics of drug taking and drug trading at the community level. Matindi doon eh.
Yeah.
Kita mo doon yung dynamics and it can reflect on what's happening at the macro level. That's why nga doon sa anthropology, sinasabi nga natin, di ba? Connecting the dots. So I think we need to really work on that and then encourage our lawmakers policy na really invest. Kung gusto natin malutas yung problema, wala sa residential treatment, wala doon sa nasa community. And then how we develop, we develop.
Yeah, may be recognized. Yeah.
Okay. Thank you.
Ano ba yun? Yeah, was that? Yes.
Yeah. Just to interject, nabanggit na rin ni Dr. Estacio. Yeah, that's the reason why the ILG, together with DOH and DDB, proposed a bill on the Anti-Drug Abuse Council bill, hopefully to become a law soon, focusing really on what Dr. Estacio is mentioning, on strengthening the community, on auditing the community and helping the community at the same time on the ground level to help our PWODs, to be rehabilitated on the ground level, specifically tapping the family, family contribution and the community as well. That's why strengthening of the local government is very important in this fight against illegal drugs. Thank you.
Thank you.
If I may add, recently the Katatagan Contra Droga was officially adopted by the DDB to the efforts of Dr. Gina and Renew Health colleagues. So it's now officially recognized as an aftercare and reintegration model. And the name of the KKDK now is Katatagan, Kalusugan at Damayan ng Komunidad program. So it's really a multidisciplinary approach to yung KKDK, which integrated yung Filipino culture, sociological factors, but of course we focus on life skills like pagtatanggi kapag merong nagalok ng droga, and also family factors like yung sa latter modules we focus on family support. And then of course yung aftercare. Dapat mahalaga din yung aftercare. Thank you.
Yeah. Just to add also to what Doctor has mentioned, it's not only KKDK that we plan to recognize and make it official. No, we also have the Undoc coalition, anti-drug abuse coalition building amongst community, including one of the model also the Yakap Bayan model of both DSWD and DOH. We are hoping that we could come up with a resolution in the Dangerous Drugs Board and eventually come up with a DILG memorandum circular, recognizing all these different kinds of community-based and reintegration format to be used by different local governments. This is one way of telling that there's so many models that you can use, and hopefully that could be effective for your community.
I agree with Yusek Echeverry.
Thank you, Yusek, for those comments. And I think it really enriched our discussion on regarding not only the science of substance abuse, but actually the intervention of how we should be able to prevent drug abuse. I think there are several comments, also in the chat box. It seems to me that culturally we should be able to do this, and the family is the start. So strengthening family ties from the very beginning, from childhood, is something very important. So pagtitibayin ang kulturang Pilipino, mapagmahal sa mga anak, mapagmahal sa mga magulang. Ang magiging haligi po ng ating lipunan ay talagang nag-uumpisa sa ating mga pamilya. At ito po ay nasabi na po ni Dr. Estacio. At ang ating gobyerno, sabi nga po ni Yusek Echeverry, ay pinagtitibay na rin po ang mga programa upang ang problema ng substance use ay masolusyonan. So marami pa ho tayong pwedeng pag-usapan, ngunit alas 12 na po at siguro ay panahon na para tayo ay magpahinga at kumain at mag-relax ng konti bago tayo ulit mag-resume at 1 o'clock in the afternoon. So I'm very happy to have been able to moderate this session, and I'd like to be able to invite everyone to stay tuned and please come back at 1 p.m. And I think back to you, Ms. Joanne. Thank you po.
Thank you. Thank you to our distinguished speakers and academician Chong. To show our appreciation, we would like to present the following certificate of appreciation to Dr. Gail Gomez. And we also want to present the same certificate of appreciation to Dean Estacio.
Salamat po.
Again, thank you, Dr. Gomez and Dr. Estacio, for our 4th session. May we now ask our speakers to turn on their video for a photo session. The Secretariat will give the cue.
Can we have the speakers from the first session, whoever are still here?
I cannot open my video. I think the host.
Can you please assist the other speakers, IMS?
Yeah, there. Thank you.
I can also not open my video. So hindi lang ko kayo, pati ako.
Can see you, ma'am.
Yeah. So can we have all the moderators and the speakers and of course our session? Okay. Can we have a photograph? Okay. Look at the camera.
Ready? Please stay for 5 to 10 seconds smile. Para may mga angles. 1, 2, 3. One more po. 1, 2, 3. Okay na po.
Maraming salamat po and see you.
Maraming salamat. We would like to invite everyone.
Thank you so much. Thank you so much.
Thank you. We would like to invite everyone to visit the NAST and ACDP social media accounts on Facebook, Twitter, and Instagram, and use the official hashtags #SubstanceUsePolicyPH, #Pilipinas, and #ACDPilipinas. We will resume after our lunch break and return for the fifth and final session of this forum and the conference synthesis. Thank you very much, everyone. See you later.
Thank
Thank you
you.
so much. Thank you so much.
Thank you.
The National Academy of Science and Technology Philippines. Since 1976, the National Academy of Science and Technology Philippines has been the symbol of the nation's commitment to science. The NAS Philippines is mandated to recognize outstanding achievements in science and technology, as well as provide meaningful incentives to those engaged in scientific and technological researches. The Academy also advises the President and the Cabinet on matters related to science and technology. NAS Philippines engages in projects and programs designed to recognize outstanding achievements in science and promote scientific productivity. The Academy also embarks on programs traditionally expected of an Academy of Science. NAS Philippines has 4 functions. The recognition function. The Academy recognizes and provides incentives to Filipino scientists for outstanding achievements in scientific research and development. NAS Philippines recommends individuals to be conferred the Order of National Scientist, the highest honor given by the President of the Republic of the Philippines to a Filipino man or woman of science in the country who has made significant contributions in one of the different fields of science and technology. NAS membership. Membership to the Academy is by peer recognition and carries with it the title of academician. Elected as academicians are resident Filipino scientists who have made exemplary contributions to science and technology and have advanced its cause in the Philippines. Corresponding membership is conferred on non-resident Filipino scientists who have made exemplary contributions to the advancement of science and technology in the country. The Academy continues its primary mandate of giving awards to Filipino scientists and scientific and technological endeavors aimed at advancing the state of Philippine science and technology with the following awards. NAS Awards. Outstanding Young Scientist. Outstanding Book or Monograph Awards. Outstanding Scientific Paper Awards. NAS Award for Outstanding Research in Tropical Medicine. NAS Environmental Science Award. NAS Talent Search for Young Scientists. Dr. Reminiano T. de Ocampo Visionary Awards for Medical Research. DOST Awards or NSTW Awards. Outstanding Research and Development Award or the Eduardo A. Quisumbing Medal for Basic Research and Julian A. Banzon Medal for Applied Research. Outstanding Technology Commercialization Award or the Gregorio Y. Zara Medal. Outstanding Science Administrator Award or the Dioscoro L. Umali Medal. Magsaysay Future Engineers or Technologist Award. DOST International Publication Award. DOST Granted Patent Utility Model Award. Activities under recognition function. NAS Lecture Series. The activity aims to promote science and technology and bring our scientists closer to the grassroots. NAS Symposium for the Youth. The activity aims to promote science and technology and to bring our scientists closer to the youth. Research Upgrading and Performance Evaluation. A series of capability building workshops that aims to help researchers to conduct research projects and produce R&D outputs. The second function is the advisory function. Through its advisory activities, NAS has been able to bring science and technology closer to the lives of the Filipino people. Activities such as legislative and information fora, roundtable discussions, conferences, with topics about biotechnology, genetic engineering, research performance evaluation, manufacturing, intellectual property rights, information and communications technology, among others. The main activity of the advisory function is the annual scientific meeting. The function also conducts annual regional scientific meetings in Luzon, Visayas, and Mindanao. Speakers Bureau is a program under the advisory and advocacy functions of NAS Philippines. This activity aims to gather and bring experts in various fields to lend their expertise to academic institutions or any interested organizations who are in need of speakers and resource persons on any science-related issues. Scientific linkages function. NAS's commitment to international and national linkages are aimed at promoting collaborative efforts among Filipino scientists and between Filipino and foreign scientists, promoting and encouraging scientific cooperation through Scientist Exchange Visit Program under the Memorandum of Agreement between NAS and the Foreign Science Academy. The Academy has maintained linkages with 29 science academies and institutions all over the world. The fourth function is the maintenance of the Philippine Science Heritage Center. Philippine Science Heritage Center was created under Republic Act 9107 to be the country's main repository of the contributions, achievements, and accomplishments of Filipino scientists in the field of science and technology. The activities under the Philippine Science Heritage Center are Salin Lahi Symposium, a series of symposia tackling one S&T related matter to bring science closer to the public and to areas not usually reached by scientific conferences and seminars targeting elementary and high school students and teachers. Meet Your Scientist, a monthly seminar that aims to promote the achievements and contributions of Filipino scientists and increase awareness and appreciation of students on science-related degrees and inspire them to pursue careers in these fields. The NAS Philippines is also in charge of the Scientific Career System. The Scientific Career System is a system of recruitment, career progression, recognition, reward, and attraction of scientists in the public service. NAS Philippines envisions itself as an academy of recognized experts that serves as principal advisor to the nation in science, technology, and innovation, contributing to national development. Together, let's work hand in hand towards a progressive Philippines anchored in science.
Welcome to the Philippine Science Heritage Center's new Salin Lahi Science Center, honoring our top Filipino scientists and their game-changing contributions to the world of science. Know more about all of them and let the Salin Lahi Science Center be your gateway into their minds. Salin Lahi.
be interesting to be very scientific about this. Let's take a look at the data and then see what the data would tell us.
So then, this is the time now that we can do our public health education. Here in Cagayan de Oro, that's what we're doing.
There is hope in each other. We need to tell each other the truth, right? So that, and we need to be advocates for the truth, what we know. We need to help guide our family members, people who are in our circles, to look at evidence, to look at data, help each other understand what these things mean.
The National Academy of Science and Technology Philippines. Since 1976, the National Academy of Science and Technology Philippines has been the symbol of the nation's commitment to science. The NAS Philippines is mandated to recognize outstanding achievements in science and technology, as well as provide meaningful incentives to those engaged in scientific and technological researches. The Academy also advises the President and the Cabinet on matters related to science and technology. NAS Philippines engages in projects and programs designed to recognize outstanding achievements in science and promote scientific productivity. The Academy also embarks on programs traditionally expected of an Academy of Science. NAS Philippines has 4 functions. The recognition function. The Academy recognizes and provides incentives to Filipino scientists for outstanding achievements in scientific research and development. NAS Philippines recommends individuals to be conferred the Order of National Scientist, the highest honor given by the President of the Republic of the Philippines to a Filipino man or woman of science in the country who has made significant contributions in one of the different fields of science and technology. NAS membership. Membership to the Academy is by peer recognition and carries with it the title of academician. Elected as academicians are resident Filipino scientists who have made exemplary contributions to science and technology and have advanced its cause in the Philippines. Corresponding membership is conferred on non-resident Filipino scientists who have made exemplary contributions to the advancement of science and technology in the country. The Academy continues its primary mandate of giving awards to Filipino scientists and scientific and technological endeavors aimed at advancing the state of Philippine science and technology by the following awards. NAS Awards. Outstanding Young Scientist. Outstanding Book or Monograph Awards, Outstanding Scientific Paper Awards, NAS Award for Outstanding Research in Tropical Medicine, NAS Environmental Science Award, NAS Talent Search for Young Scientists, Dr. Emiliano T. de Ocampo Visionary Awards for Medical Research, DOST Awards or NSTW Awards, Outstanding Research and Development Award or the Eduardo A. Casumbing Medal for Basic Research and Julian A. Banzon Medal for Applied Research, Outstanding Technology Commercialization Award or the Gregorio Y. Zara Medal, Outstanding Science Administrator Award or the Dioscoro L. Umali Medal, Magsaysay Future Engineers or Technologist Award, DOST International Publication Award, DOST Granted Patent Utility Model Award. Activities under recognition function. NAS Lecture Series. The activity aims to promote science and technology and bring our scientists closer to the grassroots. NAS Symposium for the Youth. The activity aims to promote science and technology and to bring our scientists closer to the youth. Research Upgrading and Performance Evaluation, a series of capability building workshops that aims to help researchers to conduct research projects and produce R&D outputs. The second function is the advisory function. Through its advisory activities, NAS has been able to bring science and technology closer to the lives of the Filipino people. Activities such as legislative and information fora, roundtable discussions, conferences, with topics about biotechnology, genetic engineering, research performance evaluation, manufacturing, intellectual property rights, information and communications technology, among others. The main activity of the advisory function is the annual scientific meeting. The function also conducts annual regional scientific meetings in Luzon, Visayas, and Mindanao. Speakers Bureau is a program under the advisory and advocacy functions of NAS Philippines. This activity aims to gather and bring experts in various fields to lend their expertise to academic institutions or any interested organizations who are in need of speakers and resource persons on any science-related issues. Scientific linkages function. NAS's commitment to international and national linkages are aimed at promoting collaborative efforts among Filipino scientists and between Filipino and foreign scientists, promoting and encouraging scientific cooperation through Scientist Exchange Visit Program under the Memorandum of Agreement between NAS and the Foreign Science Academy. The Academy has maintained linkages with 29 science academies and institutions all over the world. The fourth function is the maintenance of the Philippine Science Heritage Center. Philippine Science Heritage Center was created under Republic Act 9107 to be the country's main repository of the contributions, achievements, and accomplishments of Filipino scientists in the field of science and technology. The activities under the Philippine Science Heritage Center are Salin Lahi Symposium, a series of symposia tackling one S&T related matter to bring science closer to the public and to areas not usually reached by scientific conferences and seminars targeting elementary and high school students and teachers. Meet Your Scientist, a monthly seminar that aims to promote the achievements and contributions of Filipino scientists and increase awareness and appreciation of students on science-related degrees and inspire them to pursue careers in these fields. The NAS Philippines is also in charge of the Scientific Career System. The Scientific Career System is a system of recruitment, career progression, recognition, reward, and attraction of scientists in the public service. NAS Philippines envisions itself as an academy of recognized experts that serves as principal advisor to the nation in science, technology, and innovation, contributing to national development. Together, let's work hand in hand towards a progressive Philippines anchored in science.
Welcome to the Philippine Science Heritage Center's new Salinlahi Science Center, honoring our top Filipino scientists and their game-changing contributions to the world of science. Know more about all of them and let the Salinlahi Science Center be your gateway into their minds. Salinlahi.
Be interesting to be very scientific about this. Let's take a look at the data and then see what the data would tell us.
So then, this is the time now that we can do our public health education. Here in Cagayan de Oro, that's what we're doing.
There is hope in each other. We need to tell each other the truth, right? So that, and we need to be advocates for the truth, what we know. We need to help guide our family members, people who are in our circles, to look at evidence, to look at data, help each other understand what these things mean.
The National Academy of Science and Technology Philippines. Since 1976, the National Academy of Science and Technology Philippines has been the symbol of the nation's commitment to science. The NAS Philippines is mandated to recognize outstanding achievements in science and technology, as well as provide meaningful incentives to those engaged in scientific and technological researches. The Academy also advises the President and the Cabinet on matters related to science and technology. NAS Philippines engages in projects and programs designed to recognize outstanding achievements in science and promote scientific productivity. The Academy also embarks on programs traditionally expected of an Academy of Science. NAS Philippines has 4 functions. The recognition function. The Academy recognizes and provides incentives to Filipino scientists for outstanding achievements in scientific research and development. NAS Philippines recommends individuals to be conferred the Order of National Scientist, the highest honor given by the President of the Republic of the Philippines to a Filipino man or woman of science in the country who has made significant contributions in one of the different fields of science and technology. NAS membership. Membership to the Academy is by peer recognition and carries with it the title of academician. Elected as academicians are resident Filipino scientists who have made exemplary contributions to science and technology and have advanced its cause in the Philippines. Corresponding membership is conferred on non-resident Filipino scientists who have made exemplary contributions to the advancement of science and technology in the country. The Academy continues its primary mandate of giving awards to Filipino scientists and scientific and technological endeavors aimed at advancing the state of Philippine science and technology with the following awards. NAS Awards. Outstanding Young Scientist. Outstanding Book or Monograph Awards. Outstanding Scientific Paper Awards. NAS Award for Outstanding Research in Tropical Medicine. NAS Environmental Science Award. NAS Talent Search for Young Scientists. Dr. Emiliano T. De Ocampo Visionary Awards for Medical Research. DOST Awards or NSTW Awards. Outstanding Research and Development Award or the Eduardo A. Casumbing Medal for Basic Research and Julian A. Banzon Medal for Applied Research. Outstanding Technology Commercialization Award or the Gregorio Y. Zara Medal. Outstanding Science Administrator Award or the Dioscoro L. Umali Medal. Magsaysay Future Engineers or Technologist Award. DOST International Publication Award. DOST Granted Patent Utility Model Award. Activities under Recognition Function. NAS Lecture Series. The activity aims to promote science and technology and bring our scientists closer to the grassroots. NAS Symposium for the Youth. The activity aims to promote science and technology and to bring our scientists closer to the youth. Research Upgrading and Performance Evaluation. A series of capability building workshops that aims to help researchers to conduct research projects and produce R&D outputs. The second function is the advisory function. Through its advisory activities, NAS has been able to bring science and technology closer to the lives of the Filipino people. Activities such as legislative and information fora, roundtable discussions, conferences, with topics about biotechnology, genetic engineering, research performance evaluation, manufacturing, intellectual property rights, information and communications technology, among others. The main activity of the advisory function is the annual scientific meeting. The function also conducts annual regional scientific meetings in Luzon, Visayas, and Mindanao. Speakers Bureau is a program under the advisory and advocacy functions of NAS Philippines. This activity aims to gather and bring experts in various fields to lend their expertise to academic institutions or any interested organizations who are in need of speakers and resource persons on any science-related issues. Scientific Linkages Function. NAS's commitment to international and national linkages are aimed at promoting collaborative efforts among Filipino scientists and between Filipino and foreign scientists, promoting and encouraging scientific cooperation through Scientist Exchange Visit Program under the Memorandum of Agreement between NAS and the Foreign Science Academy. The Academy has maintained linkages with 29 science academies and institutions all over the world. The fourth function is the maintenance of the Philippine Science Heritage Center. Philippine Science Heritage Center was created under Republic Act 9107 to be the country's main repository of the contributions, achievements, and accomplishments of Filipino scientists in the field of science and technology. The activities under the Philippine Science Heritage Center are Salin Lahi Symposium, a series of symposia tackling one S&T related matter to bring science closer to the public and to areas not usually reached by scientific conferences and seminars targeting elementary and high school students and teachers. Meet Your Scientist, a monthly seminar that aims to promote the achievements and contributions of Filipino scientists and increase awareness and appreciation of students on science-related degrees and inspire them to pursue careers in these fields. The NAS Philippines is also in charge of the Scientific Career System. The Scientific Career System is a system of recruitment, career progression, recognition, reward, and attraction of scientists in the public service. NAS Philippines envisions itself as an academy of recognized experts that serves as principal advisor to the nation in science, technology, and innovation, contributing to national development. Together, let's work hand in hand towards a progressive Philippines anchored in science.
Welcome to the Philippine Science Heritage Center's new Salin Lahi Science Center, honoring our top Filipino scientists and their game-changing contributions to the world of science. Know more about all of them and let the Salin Lahi Science Center be your gateway into their minds. Salin Lahi.
Be interesting to be very scientific about this. Let's take a look at the data and then see what the data would tell us.
So then, this is the time now that we can do our public health education. Here in Cagayan de Oro, that's what we're doing.
There is hope in each other. We need to tell each other the truth, right? So that, and we need to be advocates for the truth, what we know. We need to help guide our family members, people who are in our circles, to look at evidence, to look at data, help each other understand what these things mean.
The National Academy of Science and Technology Philippines. Since 1976, the National Academy of Science and Technology Philippines has been the symbol of the nation's commitment to science. The NAS Philippines is mandated to recognize outstanding achievements in science and technology, as well as provide meaningful incentives to those engaged in scientific and technological researches. The Academy also advises the President and the Cabinet on matters related to science and technology. NAS Philippines engages in projects and programs designed to recognize outstanding achievements in science and promote scientific productivity. The Academy also embarks on programs traditionally expected of an Academy of Science. NAS Philippines has 4 functions. The recognition function. The Academy recognizes and provides incentives to Filipino scientists for outstanding achievements in scientific research and development. NAS Philippines recommends individuals to be conferred the Order of National Scientist, the highest honor given by the President of the Republic of the Philippines to a Filipino man or woman of science in the country who has made significant contributions in one of the different fields of science and technology. NAS membership. Membership to the Academy is by peer recognition and carries with it the title of academician. Elected as academicians are resident Filipino scientists who have made exemplary contributions to science and technology and have advanced its cause in the Philippines. Corresponding membership is conferred on non-resident Filipino scientists who have made exemplary contributions to the advancement of science and technology in the country. The Academy continues its primary mandate of giving awards to Filipino scientists and scientific and technological endeavors aimed at advancing the state of Philippine science and technology by the following awards. NAS Awards. Outstanding Young Scientist. Outstanding Book or Monograph Awards. Outstanding Scientific Paper Awards. NAS Award for Outstanding Research in Tropical Medicine, NAS Environmental Science Award, NAS Talent Search for Young Scientists, Dr. Reminiano T. de Ocampo Visionary Awards for Medical Research, DOST Awards or NSTW Awards, Outstanding Research and Development Award or the Eduardo A. Kasumbing Medal for Basic Research and Julian A. Banzon Medal for Applied Research, Outstanding Technology Commercialization Award or the Gregorio Y. Zara Medal, Outstanding Science